Hi everyone. Sorry, I need my notes to know who I am. My name is Ben Corio. I'm one of the HP project leads here at SEARCH, the Centre for Excellence in Rural Sexual Health. I work from Wangaratta and live in Yackandandah in northeast Victoria. It's my pleasure to welcome you all to SEARCH's Sexual Wellness Professional Development webinar for September 2024. We host PD webinars monthly for most of the year, so I would encourage you to check out our website and be on the lookout for our bi-monthly newsletter for news about future webinars, hopefully not missing any other stuff you'd like to attend. As we get started, I'd like to offer an acknowledgement of country on behalf of SEARCH to acknowledge the Bangarang people of the Yorta Yorta Nation, who are the traditional custodians of the land that I'm speaking to you from. I also acknowledge the traditional custodians of the lands on which each of you are living and working today. We extend this respect, of course, to elders past and present, and to all Aboriginal and Torres Strait Islander colleagues joining us today. And as I often say, indeed, to the Aboriginal people who may be the intended beneficiaries of the work that we're going to do today. It is my pleasure to introduce Zahra Stardust and Professor Kath Albury. Zahra Stardust is a porn studies scholar interested in the regulation of sexual cultures. Her work specialises in sexual media and sex tech, focusing on the politics of sexual content moderation, including the production, distribution and regulation of explicit media, and the development of community-led social justice sex tech. Her first book, Indie Porn, Revolution, Regulation and Resistance, explores the clash between indie porn producers, governments and big tech. Her next co-authored book, Sextech, A Critical Introduction, explores key debates in sex tech design, manufacture and governance. Zahra is a lecturer in digital communication at the Queensland University of Technology and an affiliate at the Berkman Klein Centre for Internet and Society. Professor Kath Albury is an Australian Research Council Future Fellow, leading the Digital and Data Capabilities for Sexual Health project, and an Associate Investigator in the Swinburne University of Technology node of the ARC Centre for Excellence for Automated Decision-Making and Society. She's also a Chief Investigator on the Swedish-Australian collaboration Digital Sexual Health, Designing for Safety, Pleasure and Wellbeing in LGBTQ+ communities. Professor Jenny Sundén. Kath's past two projects have investigated young people's practices of digital self-representation and the role of user-generated media, including social networking platforms and dating apps, in young people's formal and informal sexual learning, safety and wellbeing practices. Her recent co-authored books include Everyday Data Cultures with Jean Burgess, Anthony McCosker and Rowan Wilkin, and Data for Social Good with Jane Farmer, Anthony McCosker and Amir Arihami. So just before I hand over to Zahra, a little bit of housekeeping. We're going to hopefully have time for questions at the end. What we've agreed will be best is just feel free to pop those in the chat so that our presenters can consider them as we go, and I'll sort of aggregate them and pose them at the end. We may be able to just take questions from the floor too. And finally, I would just note that we are recording this session, so if your question to be anonymous, please note that when you ask it. Without any further ado, Zahra, over to you.
Thank you so much. Let me just share my screen. Thank you for having us. I have a small toddler with me today, so I'm hoping that they are going to just be watching Bluey quietly in the background. But if that doesn't go to plan, Kath has kindly agreed to take over for me. Thank you so much for having us. It's a real pleasure to be here. Kath and I wanted to share with you some sex tech research that we have been doing over the last few years. As you might know, our backgrounds are quite broad in the realm of sexual health. We've been working on projects over the last decade or so around pornography, around sexting and selfies, around sexual content moderation, and more recently around sex and technology. And we are both at a Centre for Automated Decision Making in Society, where we've been looking at the kinds of data that sex tech devices collect, and really been interested in issues around design and governance. So we're going to present for probably about half an hour, maybe a bit longer. We'd really love to hear some of more about your own professional practice or research and the overlaps that we have. I know that we're all joining from different places today. Our research, at least at my end at QUT, has been based on the land of the Turrbal and Yugara people. I'm joining from Yugambeh country, where I live, the lands of the Wurundjeri people, which means pretty-faced wallabies. And yes, I'd love to read in the chat where everybody is joining from today, and also to acknowledge that Kath is joining from the land of the Wurundjeri people of the Kulin Nation, and to recognise traditional owners of these spaces and pay respect to elders past and present, and any Aboriginal and Torres Strait Islander people today. We've really been thinking about Sextech very broadly as part of our project over the last 2 years. Sextech really is an umbrella term. It can include anything from fertility tracking apps to sex education chatbots and smart vibrators. It can also include devices that have wireless connectivity, Bluetooth or internet, built-in sensors, things that collect real-time data that make them more responsive and more personalized. And this is a map by the Future of Sex, where they've categorized different kinds of sex tech that they envisage for the future. What really piqued our interest in sex tech a few years ago were some public conversations about data privacy and what this could mean for LGBTQ communities, including people living with HIV, sex workers, marginalized communities whose data is sensitive. Sex tech devices collect lots of intimate data about users, ranging from the kinds of calories you've burnt, your sexual activities, positions, duration, details sometimes about your sexual partners or the geographic location of where you've had sex, your masturbation habits, sometimes your sexual health test results or diagnosis. And that kind of data is often vulnerable or susceptible to different uses. So we were interested in where apps do collect data about, for example, a person's HIV status or the trans identity, how they might be potentially used to further place people at risk of stigma or blackmail or policing, or to prosecute people in different jurisdictions. We were interested in apps that collect data about how promiscuous someone might be or map out their sexual networks and how that could be used as sexual history evidence to attack people's witness character or credibility. So we're interested in these kinds of politics of sensitive data governance. And at the time, like over the last 5 to 10 years, there's been a number of cases where users have started holding tech companies accountable. WeVibe settled a $4 million class action suit after they were collecting data about users' body temperatures and their vibration frequency without their knowledge. You probably saw in the media that period tracking app Flow also settled a case following complaints that they had misled consumers about the disclosure of their health data, including selling it or giving it to third parties like Facebook and Google, and also Grindr, who was fined 100 million Norwegian krone for sharing their data with third parties for advertising purposes. So a couple of years ago, we did some preliminary research with the Sextech School, which is like an online accelerator for sex tech entrepreneurs and startups. And it's a cohort that is largely being schooled in marketing and branding and fundraising. Sex tech is a space where there's kind of this impotence that everyone can be part of it. Whatever your background or expertise, all you need is enthusiasm, and you can kind of build an empire, but they're not necessarily being trained in data governance, at least not at the Sextech school. And so we ran a workshop with Sextech school kind of prospective entrepreneurs and spoke to them about their understanding and their skills in data governance. And we found that they often drew upon their frustrations as users, and as users, they felt, well, our data should be protected, and they felt a lot of responsibility about handling sensitive data, and they wanted to do it ethically, but they needed more information on how to comply with the regulatory requirements, which they found very confusing, and they also wanted kind of improved industry standards and practices, and they were looking for guidelines about how to kind of do it properly. So following that, we got some seed funding to coordinate a public interest Sextech hackathon at the ADMS with our colleague Jenny Kennedy. There have been lots of Sextech hackathons around the world over the last 5 years or so in London and in Singapore, in New York, and many of them have focused on pleasure. For this one, we decided to focus more on public interest Sextech and social justice Sextech. And we had a 3-day event where people could brainstorm and create their own Sextech design in groups, whether it be an app or a bot or a platform or some other piece of technology. They heard from a number of different industry experts. They were guided by a community panel who spoke about the politics affecting their communities. They received feedback from mentors. And then on the 3rd day, they pitched their design to expert judges who awarded prizes. And we then collected some of their data and their deliberations after the event. As part of that project, we also wanted to ask people about how they imagined liberatory technologies for the future. And we used this really cool set of a card deck, which is called the Oracle cards, Oracle for Transfeminist Tech, which were created by Joanna Geron and Clara Giuliano from Coding Rights and Sasha Kostanzachok from the Design Justice Network. And it was a tool for us to be able to help people to engage speculatively in how they might create technologies that benefited their communities. And what we found from the hackathon was that there were still these kinds of tensions between the market demands of sex tech cultures and then the radical possibilities for what a kind of queerer or anti-surveillance sex tech could look like. So this sort of techno-utopian ethos of startups still crept into the language of how people described their ideas, even though there was no criteria for people to come up with anything that was either technically viable or commercially marketable. We deliberately left those out. Some still pitched their ideas in terms of products that they could be monetized or optimized for market growth. And then on the other hand, others were concerned about how sex tech could go wrong, how it could be weaponized against communities, that sex tech in particular was something that was very susceptible to co-optation and infiltration and extractive business models. And it was something that requires a lot more robust scaffolding for accountability. So the outcome was really thinking of less about commercial viability and more about what is the political viability of sex tech design. So then, having done some of that preliminary work around design and data governance, we wanted to understand a bit more about queer user experiences of sex tech. And we received some funding from Forte, who's a Swedish Research Council for Health, Working Life and Welfare, to work with our colleague Jenny Sundén at Södertörn University in Stockholm for a project that we call Digital Sexual Health, Designing for Pleasure, Safety and Wellbeing in LGBTQ communities, to compare data between Australia and Sweden. And we've foregrounded pleasure in this because pleasure is a central part of sexual health. And we've wanted to think about sexual wellness as something that goes beyond reproductive health or STIs. We did 25 interviews with LGBTQ sex tech users. We also did 13 interviews with retailers as well. And we asked people about accessibility, about cultural relevance, about affordability, about safety, about privacy and security, and about pleasure. And people reported different things that they wanted from Sextech. Unsurprisingly, they said that most Sextech on the market did not meet their needs. They wanted more organizations and products that aligned with their values. They wanted marketing materials that included diverse identities, bodies, and experiences. They wanted gender neutral design. They want sex tech that works with the specifics of people's bodies, products that were made by community for community that they could support. They wanted safer spaces to purchase sex tech, whether that is an online store or a bricks and mortar store. They wanted sex tech that is financially accessible and easy to use, as well as safe, high quality materials and something that was attentive to their privacy needs as a user. In terms of cultural relevance, there was lots of discussion about the pink femininity of sex tech designs, especially sex toys, that could give rise to a kind of dysphoric experience for some trans folk that wasn't designed for everybody's body in mind. People also spoke about affordability in terms of the price points of accessing sex toys in particular, and they wanted community vouching for things that they were going to spend a substantial amount of money on. There was a focus on curiosity over optimization. So while sex tech marketing often focuses on faster, better, how we measure orgasms, how we visualize our orgasms, you know, the Lioness vibrator, for example, you can track and chart your orgasm, which was super exciting, but also the users found they often prioritize curiosity or exploration or variety and unpredictability in sex toys, rather than that kind of linear approach. They also discussed finding pleasure in glitchy sex tech, in the unruly and the unpredictable. People had off-label uses of sex tech. People created a lot of their own sex tech, whether it be lube or other kinds of devices. People found humor in moments of glitch and mishap. And they were interested in sex tech that explored erogenous zones and arousal that were outside this kind of orgasm-centric focus, outside just having orgasm as the kind of pinnacle experience. And like has been found in other hackathons in the UK, for example, where Kate Devlin ran a hackathon, there was a focus a bit more on abstract design and post-humanism in design, away from human realism, so towards fantasy sex tech, dragon's eggs and tentacles and things like that. Most people discuss sex tech as being a facilitator of communications. It wasn't so much about the device or the tech itself. It was more about it was a means to work through trauma, to find healing, to process stigma or shame or anxiety or depression, to communicate in their relationships. A lot of people spoke about needing a more accessible and assistive sex tech, especially toys that limited the need for great motor skills, things that they could use hand-free. And Kath will talk a little bit shortly about how people navigated pain as well. People talked a lot about affordability, findability, especially with the closure of a lot of physical stores and and sometimes the unreliability of online stores. And they had a preference for choosing products that could be vouched for by community, as well as products that were travel friendly. You know, with the risk of immigration scrutiny, they wanted things that were kind of discreet. So what does this all mean for clinicians and sexual health organizations for policymaking? So Kath is going to talk a little bit now about some work she's been doing on digital and data capabilities for sexual health organizations as part of her future fellowship work, and about how people use platforms to find information about sexual health and what individuals think that sexual health organizations should know. One of the things we found in our research was that people were using devices for different off-label uses. So for example, menstrual tracking apps, most people weren't using them for fertility at all. They were using them to track their pain, especially for conditions like endometriosis. So I'm going to hand over to Kath, and Kath is going to share a little bit about how people are using data-driven tech to support their own sexual reproductive health. and then what the workforce needs to know about supporting those consumers.
Awesome. Thank you, Zahra. Brilliant segue. Yes, so in parallel to the Sextech work that Zahra has been talking about, I am working on a project which is looking at digital and data capabilities for the sexual health and also reproductive health workforce. This comes from past work I was involved in with my colleague Anthony McCosker here at Swinburne University of Technology as part of the ARC Centre of Excellence for Automated Decision Making in Society, where we did work with the not-for-profit sector more broadly, looking at digital and data, because I should say data capabilities in a more specialised way. I've broadened out in this project to look at digital and data capabilities. And we've done this for a range of reasons in our project. We know that a bunch of Commonwealth policies are coming in right now that are both encouraging and supporting digital upskilling for the sexual health workforce, the health workforce more generally, but we also know that these were designed to be agnostic. So therefore health practitioners, therefore health promotion professionals, therefore allied health workforce, they're not for any particular specialization or discipline. And this means they don't take account of the specific issues in relation to data, particularly that Zahra has pointed to in our work on Sextech that might affect people seeking sexual and reproductive health care. We know that lots of people go online when they have questions about their bodies and their sexualities. We know that health researchers do this too. We know that health practitioners do this too. But concerns around things like STIs and HIV or unplanned pregnancy are really very personal and very sensitive. And people want to be anonymous when they're seeking out this information, and they want to be able to have a really clear idea of where that information is coming from. I will also say, and this is a bit of a setup for what I'm going to talk about in a minute, people are not necessarily looking for factual information at all. There's a lot of interdisciplinary research that indicates that people also want insider information, and they want to be validated in terms of their own experiences. They want access to expert information and services, but they also want information from their community and their peers. So this project was intended to really understand, in the first instance, what digital and data capabilities look like in sexual health research policy and practice at the present time, and then where we could develop some new resources that basically translate very high-level Commonwealth guidelines and action plans into guidance for what you might term strategic conversations in health workforce settings. And as I say, this isn't necessarily clinical settings. I'm thinking about the health workforce really broadly. Do you mind clicking on to the next slide, please, Zahra? So in stage one, we did some scoping work. We did a literature review looking at the ways that digital literacy and digital health literacy were talked about in relation to sexual health, STIs, a range of terms you can see on the screen there. Basically, what we found was that digital literacy is considered to be very important, obviously, but when the literature talks about who needs digital literacy, by and large, it's a conversation about health consumers. It doesn't really talk about the needs of health practitioners. And we know, for example, in relation to health literacy is not just a thing that health consumers are expected to cultivate on their own. It's the responsibility of health service providers to create a kind of a supportive environment for health literacy. We moved away from the term literacy actually pretty early on in our study, because what we found was that the term literacy can be implied. It's a kind of individual attribute or an individual deficit. It doesn't necessarily speak to enabling environments in the way that capabilities as a term does. So capabilities, I should say, is also the term the Commonwealth is using in relation to digital upskilling in the workforce. We've adopted the term because we liked the way that the term capabilities moved away from just talking about individual skills and actually encompassed the broader infrastructure, access and governance aspects of digital transformation. So I might be, for example, the most digitally skilled health promotion professional in the world. But if I'm in an organization that basically has a firewall, I can't access any kinds of social media, I don't have a mobile phone as part of my job, there's no interoperability of my systems, the governance structures are not set up to facilitate my work, I don't actually have much digital or data capability in that situation, even if my individual literacy is strong. We also did some work with key informants and stakeholders and asked them about where they saw digital and data literacy playing out in the sexual and reproductive health sector. Thanks, Zahra. I'll go to the next slide. And once we'd done this scoping work, we went to talk to people who were using digital technologies as part of their sexual and reproductive health. Sorry, we've skipped one too far, Zahra. Can we go back? Okay, thanks a lot. So these were our tech users. They were mostly cis women, which was interesting. You can see the recruitment that they replied to. And as Zahra said, in relation to the Sextech project, there were lots of people using digital technologies to help them better understand and manage their experiences of chronic illness and chronic pain. So many people spoke about endometriosis, polycystic ovarian syndrome. There was lots of discussion of getting a better understanding of what was involved in IUD insertion and aftercare for that experience. And this is where we began to think about the ways that people were seeking to access not just factual information, because they all said, you know, they could go to a medical site to get the actual facts on these health conditions, but more interested in kind of experiential accounts that help them both validate their own experience, but also build their vocabulary for self-advocacy. So where, for example, someone was seeking gender-affirming care, or where they had waited quite a while to see a specialist and they were finally seeing the specialist to get a pain management plan, for example, people wanted to understand how their peers had experienced these situations and how they could best prepare for this experience. So I would actually term it a community of practice in many ways. People were seeking, in some cases, an anonymous community of practice on sites like Reddit, or they were looking on sites like TikTok for what they called lived experience of managing pain or dealing with questions about consent or thinking about STIs or a range of issues that we would consider sexual and reproductive health care. This doesn't mean that they took everything they saw online as face value. At face value, I should say people were skeptical of the information they saw and that they had their eye out for hyperbole, but they really valued getting the diversity of views and experiences before or alongside accessing formal health practitioners. Thanks, Zahra. We'll go to the next slide. In the next stage of this project, we are actually about to share a set of resources and some frameworks that we've developed on digital and data capabilities for both the health workforce and also health consumers. So as part of this consultation process, we also consulted with some small groups of participants who were aged 18 to 29, who were both young people, according to, guidelines, outlining priority populations in health strategy, but who were also sexual and reproductive health professionals themselves. And we asked them to both give us feedback on the resources we were developing, but also to talk about their experiences of the health sector and what they wished that leadership in their sector knew about the work they were doing. We are about to launch the report on this work on the 8th of October, and I'll share a link at the end of this presentation. So I'm not going to talk too much about those findings, but you're very welcome to join us at that report launch or to download the report later. Thanks, Zahra. So these were the platforms that people were using to support sexual and reproductive health in our study. And you can see it was a really diverse set of platforms and resources, some very formal and probably, expected, things like WebMD, for example. Others, more diverse. So porn was mentioned as a site of sexual health information. So with dating apps, I will say too, as Zahra said, people certainly talked about using menstrual trackers to manage endometriosis. They also talked about menstrual trackers as part of their dating experience. So one of our participants who was in a consensually non-monogamous relationship used a Google Calendar alongside her menstrual tracker to arrange sex dates with various configurations of partners, and it was a way that her regular partner and her occasional partners could keep track of when she was feeling like she might be up for play. So it was that was a kind of technologically mediated sexual health activity, I guess you could say. Thanks, Zahra. We'll have a look at the next one. So as I say, people used the term lived experience quite a bit in our research, and it wasn't necessarily used in the same way that you might use the term lived experience if you were developing or evaluating a health service. But when people were talking about what they would like service providers to know about their use of digital technologies, many participants emphasized that they saw social platforms as sites of lived experience. And yes, they took that with a grain of salt sometimes. The main thing they were concerned about was when a health practitioner might roll their eyes at them, basically, or dismiss their concerns or their questions because they happened to mention something they saw on TikTok. They didn't really get into debates around information and misinformation, which I know is big kind of in health conversations, and I've been to many conference panels that talked about it. Really, they saw this as a domain of lived experience, and what they wanted was just for the health professional, whoever they were, to just keep a neutral face when they talked about TikTok or whatever, and say, oh, tell me more about why you're concerned about that, and simply move on. It's pretty simple, I guess, but that was a really interesting takeaway from the project. Thanks, Zahra. We'll go to the next one. And as Zahra said, there was an interesting overlap in both the Digital and Data Capabilities project and the Sextech project, with lots and lots of gender diverse and cis people talking about using technologies to manage pain and manage chronic health conditions, or explore pleasure with disability, or with partners who were experiencing disability. So, for example, one person was talking about how she used Sextech as a kind of adaptive technology for having sex with her partner who was in a wheelchair. And really, I've included Eddie's quote here because they talk about MacGyvering things. They really felt that the professional health service providers didn't really know enough or much about the ways that tech could be used to help them manage pain and to enhance pleasure. They felt like In some cases, there was a focus on kind of managing your pain sufficiently to be productive in the world. There was less focus on managing your pain in order to actively experience pleasure, or to experience your body in a way that wasn't dysphoric if you were a trans person. This was an area where they really would like to see a better understanding of the diversity of technologies that are on the market, and maybe a clearer sense of what was recommended and what wasn't recommended, or what might be useful for different experiences or health conditions. Thank you, Zahra. So this is a link to the project report that we'll be launching on the 8th of October. It will be recorded, so if you can't attend between 2 p.m. and 3 p.m. on the 8th of October, if you register, you will be receiving a recording, and we'll also launch our stage 2 report. And then in the first part of next year, we will be rolling out a pilot of the resources that we're building now, which, as I said, are intended to facilitate strategic conversations in health organizations between people in different disciplines. So to kind of break down some of the silos and begin to talk about both the ways that young adults are using digital and data technologies as part of their everyday sexual and reproductive health kind of exploration and wellbeing practices and the ways they seek care through these technologies and devices. And we'll also talk about the ways that the health sector can better utilize data-driven digital technologies in order to provide different kinds of healthcare or health information according to your mission. Obviously, everyone is doing a slightly different job in this space. So that's a little spruik for what's coming next. I will stop now so that we can answer questions. I think we've got about 20 minutes to go. And yes, this is the word from our sponsors. We've been very generously sponsored by the Australian Research Council and FORTA, the Swedish Research Council for Health, Wellbeing and Working Life. Thanks a lot.
Thank you so much, Kath, and thank you so much, Zahra. We don't have any questions in the chat yet, so very happy to open it up to the floor. Feel free to unmute yourself and pose a question, or if you'd like to drop a question in the chat, I can read it out for everybody. I might offer a very broad question. I remember probably 7 or 8 years ago at a conference putting together a bit of a small conference, a panel discussion about this kind of topic, and really struggled to find at that point, and maybe it was just me, folks sitting in the intersection that you two seem to be sort of sitting in, which is interested in technology and sex tech specifically, but also with that broad sort of sexual health and wellbeing lens also applied. I found that I could find folks to talk about sexual health and wellbeing and folks to talk about sex tech, but they were almost in that instance at odds with each other. Is that something that you two found when you sort of started exploring the space, and how did you come to this sort of very specific space? If that's a question that can be answered.
You want to go first on that one, Zahra?
I mean, I guess the first reflection I make is that sex tech is not new, and that, but often it's kind of being discussed in this place as if it is this new and shiny thing, and especially the kind of marketing narrative at the moment is like it's this whole new field that you can jump into and become involved in. But I like to think of sex tech in a more scrappy DIY way, is that when you think about technology as something that is a tool or a framework or a resource, people have been creating their own sex tech, you know, for millennia, and queer people especially, you know, all of the ways in which we kind of find different tools and technologies to survive the world. But I think there is something something unique about this moment. I do think we're absolutely at this convergence where these things are intersecting in really interesting ways, especially now. I mean, for me as a porn studies scholar, thinking about how those debates have moved over the years from print and literature to photography and imagery and home DVD and then the internet, and now generative AI and different kind of moral panics at every moment. But now that governments are thinking about how do we moderate sexual content online and are taking a bit more of a surveillance approach. There's a lot of conversations about surveillance and surveillance capitalism as a means to do that. And we now have also the UN, a number of UN bodies are coming out and writing documents about artificial intelligence and what it means for sexual and reproductive health, and a lot of discussions about people, diagnosing or different self-diagnosing online, and also conversations about large language models and ChatGPT and what that means for people's access to information, how they're curated, what people understand about ChatGPT as something that just kind of statistically generates the next response rather than knowing what it's saying or writing, and how it incorporates a range of different biases from existing information. And then, as Kath said, it's interesting, the conversations around mis and disinformation, often for people like in your research, as you said, like it's actually people are talking about lived experience more so than mis and disinformation. And it's people are concerned about pathologization and not being able to access adequate medical care and doctors as gatekeepers and those sorts of things. So of course people are using these spaces in ways to help find tools and frameworks to survive. So yeah, I think we are in a really interesting moment for so many reasons that everything is kind of converging right now.
Yeah, I think too, when we talked about with the entrepreneurs as part of this project, I mean, I've been very interested in the blurring of public health and then a kind of market-driven or privatized promise of, the startup that will save us from a particular health condition. And, we see that at grand scale with the kind of the tech giants who promise that they know better, for example, than a small-scale national or state-based public health system, and that their disruption will save us all from particular health conditions or kind of systemic states of being. And I think one of the issues with tech is that and this isn't original to me. It's one of the things that we've seen in the space of development and many other spaces. It's a wonderful kind of enabling tool for connection in many ways, but there are many groups that have very tenuously funded, delicately arranged health networks that if you said they were ripe for disruption, like that would destroy them. Like, the language of markets is not always the appropriate language. We know even in public health, kind of project-based funding, how distressed people are with that kind of churn of 3-month funding, and what they want is kind of underpinning funding where they're not continuously chasing the next KPI or the next bucket of money. The side of tech is the site that's all about, move fast and break things, chase the next bucket of money. So this can be very kind of incongruous, but it also, as I say, is a space where there are incredible visionaries and people really trying to develop assistive technologies, you might call them, technologies that really enhance pleasure, for people who are not part of what you might call a mainstream market, but also, I will say, are not kind of part of the median or the mean on the classic epidemiological curve. Like for people who are outliers, however you want to frame that, commercial sex tech is very much the space where they are getting their needs met for sexual exploration, for gender exploration, for gender affirming care, for different kinds of pleasure, in ways that it's not being really met in classic, psychology or sexology, or, in a 15-minute consult with your GP. So yeah, on one hand, I think we're talking about it more because there's a big market push. It's been identified as an expanding market. But also, I think post-COVID, a lot of organizations are more experimental with the ways they're engaging with technology. They've been forced to move into spaces that classically might have been considered too risky. And so there's a lot more openness to thinking about digital technologies and data. When I started my project in 2022, I got a lot of blank looks when I talked to people in health organizations about what I was doing. I was at the International Union Against STIs conference last week, and everyone straight away could talk about it was very clear why we were doing the project we were doing, and what the benefits might be for people in health organizations. I don't know if that answered the question. It was a very rambly answer.
It was a pretty rambling question.
If I can also just add to that too, I think the techno solutionism, like you said, is so rife in this space, and what's happening in the Sextech space is a kind of microcosm of what's happening at a broader level with Google or Amazon or Meta, that we think we can kind of tech our way out of what are actually social problems. And I'm thinking about a hackathon that was held over in the US called Make the Breast Pump Not Suck, and they were hoping that people might come up with different solutions. For example, so there was about breast pump design, and they thought, well, maybe a policy solution to this is that people can stay home with their babies and have a different relationship to work. But actually the kinds of solutions people came up with were like, let's make it hands-free, let's do this and that, have like these techie solutions. And I think the same with around pornography regulation, like moving into how to surveil and screen content, how to verify the ages of users by using facial estimation software to estimate people's ages, instead of investing in porn literacy, or instead of investing in comprehensive sex education. So yeah, I think there's a lot to say about how techno solutionism kind of creeps into this sort of social, cultural policy space. Yeah, which is, I think, why we also need to think about like technology as an opportunity. What does tech look like when it's made by communities for communities, that maybe is not at scale, maybe it's local, and it's not about those three things of like scale, size, and speed, which essentially compromise everything. Or how we think about data in a way that's more about having a data commons, because data can be very useful for all of us working in public health. Like, it's all about the data. And so thinking about different ways in which people can have more control over their data, or that we can put the data more towards public interest uses.
Thank you both. I might go with some questions from the chat. Linda's got a great, maybe somewhat straightforward, maybe a really complex question. You talked about the eye rolling doctors, health practitioners. Do you have a good canned response?
Yeah, I don't know how to respond to the eye rolling health practitioner in the moment. I haven't practiced that one. I did have a little practice conversation with a GP at this conference last week, where I said, we learn in lots of different ways. We know what a community of practice is among professionals. Like, this person had just talked about how, as a GP who practices gender affirming care, they're in part of closed Facebook groups and WhatsApp groups where they talk with their colleagues about ways to, keep up to date with the latest research and to share information. This is exactly what people are doing in digital spaces when they're trying to manage their health. And the term communities of practice comes from a couple of anthropologists, Lavey and Wenger, who were basically observing workplaces and looking at how the apprentices in workplaces learned the skills that weren't on the formal curriculum, for example, at the TAFE college. Like, how do you learn to actually do the job? Sexuality and gender are kind of eternal apprenticeships, really. We don't get much formal training in them, and we are continually learning on the job. And it makes sense to me to think about digital domains as communities of practice. And that's quite different to a formal curriculum. It's quite different to, I guess, a site where there's assessment tasks that you can pass or fail, but it's still a site of learning. So I don't know whether that helps in the moment when the GP is rolling their eyes at you because you had the audacity to say that you learned on TikTok that sometimes IUD insertion is incredibly painful. But yeah, that's one way I'm starting to think about it, and I'm going to actually write an article, posing that and see whether it actually gets through peer review or not. That will be the proof of the pudding.
Zahra, anything you'd like to add there?
No, I'm just reading down to one of the other questions actually around do you think COVID brought Sextech to a wider group of users? And do you think this caused less understanding of how things work or collect data? I'm pretty sure there is a report about COVID and people using more remote sex toys to enjoy remote intimacies with partners during lockdown. I mean, at the time, there were, and there still are, a lot of media articles around the privacy issues. I know that Mozilla has put out a whole privacy kind of brochure that goes through all of these different remote sex toys and talks about and kind of rates them from like super creepy to not creepy in terms of like how much surveillance and privacy they afford. And I know there's many media articles that are like, don't buy an internet connected sex toy for Valentine's Day. But then we also have research data about people really enjoying having access to their own data and seeing their own data. And I mentioned the Lioness biometric vibrator earlier. There's a research article just come out on that recently about people's pleasure in playing with their data and experimenting with their data and sharing with their data with others. And so I think, and our colleague Jenny Sundén has written about this around like queer sex has always been public to some extent. It's always been something that has like some aspect of public sexuality in culture. And so I don't know that sexual privacy is the answer to this. It's not so much a matter of being like, don't share your data on apps or don't disclose or don't add this information to your profile. I think we need to think about this as some more structural issues. And one of the problems I think is that sex tech companies sometimes brand themselves as sexual wellness rather than medical devices, for example, or they frame themselves in a particular way so they don't have to get their goods approved by the TGA or whatever the case may be. Or they're not understanding that their own data is actually, that what they're collecting is actually health data or it's sensitive data or it's protected by the GDPR in Europe or whatever the case may be. So, I mean, maybe it's a data capabilities thing at the kind of sex tech level in terms of the companies who often, I mean, in this space, and we see this in pornography space too, they don't see themselves as a porn company, they see themselves as a tech company, and they're not see themselves as a camming company, they see themselves as a tech company. So yeah, I think greater literacy and capability at that level of what their actual obligations are would be important. Maybe Kath has something to add.
Yeah, I think too, I mean, I just saw it in Crikey today, IMED, the medical imaging company, has given a whole lot of chest X-ray data, given it to a health organization developing a diagnostic AI program, which, the research was published in the Lancet, and it's a very good diagnostic program, but none of the people whose IMED results were shared with that AI company and research team were invited to consent or did consent to the best of their knowledge. So I don't see this is the only place where there are data concerns, but I do, one of the things that we have been trying to be kind of thoughtful about is like what is different about sexual and reproductive health data. And we know in many cases, there's great personal risk to people whose data is exposed in a way that the exposure of my chest X-ray data, you know, doesn't put me at the same level of risk, even though it's still medical data at the same time.
So Ros has, I think, a great question, something I've grappled with. Might not be, again, something that's easy to answer. Schools are behind in understanding sex tech, and maybe we can take a very broad sort of understanding of sex tech, maybe tech and sex there. Schools are behind in understanding that. Any sort of go-tos you could advise for building, supporting teacher awareness?
I mean, I hear that a lot, that like teachers need more support, especially around porn literacy, and have conversations about pornography in the classroom, as well as generally like around sexting. And, you know, we know that in the past, the narratives have really been kind of slut-shaming or victim-blaming kind of narratives that like, don't do this or make, and I feel like sometimes that still is the case when in even groups where I've been in kind of spaces where people are like, how do we design apps with features that help people maintain their privacy, like so that you can blur your tattoos out of the images or those sorts of things, which are very useful on a day-to-day level, and there should be those kinds of features available for people, but still it doesn't really get to the root of the problem, which is like misogyny or trans misogyny or whorephobia, or like that people don't value what it takes to create a sexual image. And if we valued and respected that kind of labor, then maybe it wouldn't be weaponized, or it wouldn't be exploited, or it wouldn't be something to be ashamed of. So I feel like a lot of sometimes that kind of literacy goes in the wrong direction, in that it's not really addressing the root of the problem. But yes, generally, I think I hear that a lot from friends who work in education, that there needs to be more support. And I think that would make a really interesting project, is to kind of assess like what our teachers' needs in this space and what kind of things would be useful for them to facilitate those kinds of conversations with young people, because we know young people have really important questions. And often, and sorry, I'm going back to pornography again, but because that's the area I work in a lot, but often young people are very suspicious of the blurry understandings of harm that adults talk about in relation to pornography, and they have more sophisticated and nuanced questions. And sometimes when adults respond in a way that is angry or defensive, or shuts down conversations, that can be more harmful than the actual content itself. And so young people have really good questions, and I know many colleagues of mine have been involved, you know, like I have a colleague who set up a porn literacy panel at her daughter's school, where they had a porn star come and speak alongside sexologists and nurses. And that was really great, because, and the feedback was that having a porn star on the panel reduced the skepticism of the teens and led credibility to the whole event. And we also have great examples like Sex School, for example, which is based in Berlin, which is a group of porn performers who do sex education through explicit videos, and they talk about them. But unfortunately, that platform's just shut down a few months ago because of the systems of content moderation that make it unviable for them to exist. And that's something that I heard repeatedly in my research among indie pornographers, was that people had all of these aspirations to change how sexual content moderation was done, to do it in a way that would value people, that would still afford them privacy and afford transparency and accountability, and that would, you know, not surveil users, and platforms that want to develop greater libraries of tags, so that people can tag their content with a more comprehensive vocabulary for how we think about our bodies and our desires. And so often, like I said, what are the breaking points that meant that you had to shut down? And it's, you know, financial discrimination against sex industry businesses. It's legislation that requires them to surveil their users in a way that they feel compromises their value. It's, you know, like the kind of flagging of content. It's just, there's so many things about the regulatory space that makes it really difficult for people who are doing important political projects to actually remain viable and exist.
Can I do one shady mini comment on that? I have been researching in this field since 1997. I don't believe there's any political will in Australia to really enhance teachers' capabilities to talk about sexuality in schools. I think there's a lot of lip service. I don't think there's a real political will to do so. You can come at me and fight me, but I think I actually stepped out of that space because I no longer see any momentum or will to move along in that domain.
I'm just glad to hear someone else say it, Kath.
No, I agree entirely with that as well.
Well, on that possibly sobering note, we might move towards wrapping up. Just very quickly, Chris has asked, as a psychology undergrad, is there any way that they can get involved, either at, in their study capacity or as a community member? I mean, Kath, you did drop your mailing list up above. That might be a great place to start.
Yes, we've got a sign up. I dropped in the chat. So yeah, please get in touch and we'll get back to you.
Great. Well, Kath and Zahra, thank you very, very much for your time today. Thank you, everybody, for attending this session. If you'd like to join it or rejoin it, revisit it, will be available on YouTube. Thanks very much. Maybe a quick digital round of applause for our presenters, and hope everybody has a great rest of their week.
Thank you so much for having us. Great to be in conversation with you all.
Yeah, thank you. Bye.